Mental health stigma refers to negative attitudes, stereotypes, and discrimination directed toward individuals with mental health conditions. This stigma can manifest in various forms, including social exclusion, derogatory language, and marginalization, and it often leads to significant barriers to accessing mental health treatment. Here's how mental health stigma impacts access to treatment. Fear of judgment. Stigma surrounding mental illness can deter individuals from seeking help due to fear of being judged or stigmatized by others. The fear of being labeled as crazy, weak, or unstable may prevent people from openly discussing their mental health concerns or reaching out for support. Self-stigma. Internalized stigma, or self-stigma, occurs when individuals internalize negative beliefs and stereotypes about mental illness. This can lead to feelings of shame, low self-esteem, and reluctance to seek help. People may blame themselves for their mental health struggles and feel unworthy of receiving treatment or support. Barriers to disclosure. Stigma can create barriers to disclosing mental health issues in various settings, including the workplace, school, and within families. Fear of negative repercussions, such as discrimination, harassment, or loss of opportunities, may lead individuals to conceal their mental health concerns and avoid seeking help. Limited access to resources. Stigma contributes to the underfunding and underprioritization of mental health services and resources. As a result, there may be limited access to affordable, culturally competent, and evidence-based mental health treatment options, particularly in underserved communities and rural areas. Delayed treatment seeking. Stigma can delay or deter individuals from seeking timely mental health treatment, leading to worsened symptoms and outcomes. Delayed intervention may result in the escalation of mental health issues, increased risk of crisis or self-harm, and reduced effectiveness of treatment interventions. Reduced treatment adherence. Stigma can undermine treatment adherence and engagement in mental health care. Individuals may feel disheartened or demotivated to continue treatment if they perceive mental health services as stigmatizing or ineffective. This can lead to discontinuation of treatment prematurely and exacerbation of symptoms. Impact on relationships. Stigma surrounding mental illness can strain relationships with family, friends, and peers. Lack of understanding, support, and empathy from others may contribute to social isolation, loneliness, and diminished social connectedness, further exacerbating mental health challenges. Health disparities. Stigma perpetuates health disparities and inequities in mental health care access and outcomes. Marginalized groups, including racial and ethnic minorities, LGBTQ+ individuals, and people with disabilities, often face intersecting forms of stigma and discrimination that compound barriers to treatment. Addressing mental health stigma requires collective efforts to challenge stereotypes, promote education and awareness, and create supportive and inclusive environments that prioritize mental well-being. By reducing stigma and increasing access to culturally competent and affirming mental health services, individuals can feel empowered to seek help and receive the support they need to thrive.